Hello, this is Dr. Subramanyam here. I'm the head of the Department of Anaesthesia at Aster RV Hospital. I'm going to talk to you about a very important thing. I'm not only going to tell you important thing, I want you to participate in this program actively. The topic is pharmacovigilance. Don't be put off. Vigilance doesn't mean that you should put off all your senses. It is all about drug safety. Let us come together and make drug usage safer for everyone. This pharmacovigilance is very important because almost everyone living in India or perhaps entire world, they will take medicines one or the other. When people are taking medicines which are not food, they can have reactions. And some of them may not be mild, they can be quite severe. Fortunately, in the last few years, the government of India has developed a mechanism known as PVPI, that is Pharmacovigilance Program of India, in which every hospital, every healthcare is likely to get participation in it. And if anyone using the medicine has a reaction, has an abnormal reaction, so they can be analyzed and they can be reported into system. I'll tell you why it is important. One of the practical examples which has happened in a few decades back, in 50s and 60s, is about thalidomide. This drug was extensively used to help pregnant women with morning sickness. It did help, no doubt at all, but they started to notice that these pregnant women, they started to have children with malformed limbs. And without pharmacovigilance, without close observation, we couldn't have picked it up. This led to the birth of this. So since then, a lot of countries had started to collect the information about adverse drug reactions. Now, with the digital advances which India has happened, we have a mechanism to collect systematically. If you, while in the hospital or in the community, you have a reaction which you think it is affecting, please access medical care. Come to the emergency room. Our emergency physicians will review it, treat it, and get the clinical pharmacy department involved. And they have a standard protocol how to collect this information, feed it to the system, and so that we can review at the national level and take appropriate action to make sure the drug is given in appropriate dose, appropriate manner. If it needs withdrawn correction, it can be done. But I want you all to participate in this program. But if you are a patient, be aware that there is a mechanism to get treated and to report it. And if you're a doctor, please access this care. Make this part of your practice. Let us make healthcare a lot more safer than what it is today. And let's make primum non nocere, that means no harm for the patients, and drug safety as a central part of our everyday practice. Thank you very much.